Good day to everyone. My name is Kalle Palomäki and I'm the CEO of HLD Healthy Life Devices. We design and manufacture Lymphatic and PhysioTouch devices for physiotherapy and rehabilitation. In 2009, we introduced Lymphatic for activating the lymphatic system, and in 2011, we launched PhysioTouch as we expanded to fascia and myofascia treatments. Lymphatic and PhysioTouch have today more than 400 customers in more than 20 countries. The concept was introduced to the US in 2011, and our first big customer in the country was Johns Hopkins Hospital. Today they are using the treatment method in more than 5 different Johns Hopkins clinics, and we have several other major hospitals as our customers. Today in this session, we will show you and explain you the operating principle of the device, and we will also do a demo treatment where you see how the device can be used when it supports your manual lymphatic drainage. So let's start with the video. So here you see when the device is put on skin, the negative pressure activates automatically and starts to pull up the tissue. When the tissue is being pulled up, the tissue structures and fascia get stretched. This stretching also expands the endothelial holes and helps lymph fluid to enter the lymph capillaries. Once the lymph fluid enters the lymph capillaries, it will go further to the precollectors and to the main lymphatic veins and starts moving forwards towards the circulatory system and eventually out of the body. And now let's move this to the actual treatment. Our clinical specialist will show you how the device is used in action.
Hello, my name is Tiina Puustinen and I'm the clinical specialist for the HLD company. Today I will show you really shortly how the device Lymphatic can be used to assist the manual lymphatic therapy. As you see, we have a small device which is easy to place in the therapy setting. The device comes with the main unit, treatment handle, the cable, and 4 different sizes of treatment cups. The 2 bigger treatment cups can be used for wider body parts like torso and legs, and the smaller ones are useful for treatment of scars or axillary web syndrome, for example. So, as the treatment cup is plugged in to the treatment handle, and when the device is turned on, the device starts operating automatically. And here I will demonstrate how the different settings can be applied for the therapy. First I will show you a few settings. So we have the millimeters mercury, which is on 80 millimeters mercury at basic setting, and the pressure level can be adjusted from 20 millimeters mercury to 250 millimeters mercury, which is the maximum pressure level. The pressure level should be changed and chosen according to patient needs and the perception. The same with the treatment cup. The most important thing is that the treatment cup fits to the area to be treated. Okay, so a few more settings that we can change. So we have the negative pressure setting, and as well we can change the length of the pulse. So we can change it from 0.5 seconds to 5 seconds. The negative pressure generation can also be worked with a continuous suction. So basically if we use this setting, the treatment cup lifts the tissue as long as the treatment cup stays in skin contact with the skin. More on, we can add a mechanical high frequency vibration, and the mechanical high frequency vibration setting can be changed from 90 Hz to 20 Hz. So it's an easy touchscreen operated device. Okay, so today we will focus on a treatment of secondary upper limb lymphedema, and because we are running out of time, I will show you how to treat the affected arm itself. The Lymphatouch treatment usually starts by activating the supraclavicular fossa region above the collarbone. So I will just show you that because it's nice to know. So what I do is that I place the mouthpiece above the collarbone and keep it at the same spot for 3 to 5 pulsations. Then I will move the treatment cup to the area close to the area treated just before. Keep it still for 3 to 5 pulsations. And in total I will treat 3 to 5 spots. Okay, so I will do it on both sides. Then I will shortly demonstrate how to activate the healthy axillary lymph nodes in the armpit. So I just gently place the treatment cup in the armpit and keep it still with a stationary technique for 3 to 5 pulsations. And as the treatment proceeds, I will activate the anterior axillary anastomosis area with a stationary technique. Just gently placing the treatment cup and as we would proceed, I would treat from the healthy side towards the affected side and treat back towards the healthy side. Then treatment of the affected arm. We would start with a stationary technique to activate the tissue. And as the treatment would proceed, I would do a sliding technique towards the healthy axillary lymph nodes. Some therapists like to say that Lymphatouch is like an extension for their hands. So what's difficult to do by your hands, or if you're feeling tired after a long day, it's a nice assisting tool for the manual techniques. So of course the therapist could use the manual techniques in between and then assist the problematic areas with the device. So it's a nice complementing tool for the whole therapy. Okay. So here in between, I would again guide the fluids towards the healthy armpit. So let's say now that I have been treating the upper arm and lower arm. So I will demonstrate you how to treat the palm area. So if the patient sensations permit, I can add the negative pressure up to 150 millimeters mercury. And have a closer look. As you see, the negative pressure is actually generating through the tissue. And it's important to keep in mind that the treatment should not cause pain. So if any pain, the pressure levels should be taken down or you should lower them. Okay, normally I could go on here, but we will continue. In between, I would do a sliding technique towards the healthy side. And now I will demonstrate you how the sliding technique is done. It's a good way of really guiding the fluids back to the healthy side and towards the healthy lymph nodes. So I will take down the pressure level a bit. Just gently place the treatment cup on the skin and just really gently guide the fluids back and all the way towards the healthy axillary lymph nodes. And here, depends on the tissue, depends on the edema, I would spend several minutes what's needed in that area using that technique. I will, because different techniques can be applied for the therapy. For example, if we have scar tissue or if we have adhesions, I will show you on the lower arm what techniques can be used on the problematic areas. So firstly I will show you a lift and twist technique. So I will apply a bit more negative pressure. And during the suction I will lift the treatment cup and the rubbering just so that I give it a nice ease and help kind of an upward lifting. Okay, so this is the lift and twist technique that we could work with more locally over the scar adhesions or axillary web syndrome areas. I will also demonstrate how to use a smaller mouthpiece, so the 35 millimeters mouthpiece for local scar management, or if we have older scars. So I will change the setting for a continuous suction and work locally over the problem area with a knitting style. So, and from here the basic therapy would then continue with the sliding strokes toward the healthy axillary lymph nodes. Thank you for my demonstration.
Today you have seen here a very brief demonstration of our Lymphatic device and how that is used to support MLD techniques. If you are more interested in finding out how the device can be used and seeing other demonstrations, you can go to www.lymphatouch.com, or you can actually contact us, and we are very happy to provide you therapist references from the US who can actually explain how they have been using the device and what kind of great results they have seen. I want to thank you for watching this. Have a great day.